I don't prepare. Hello,
Start. Hello.
this is Dr. Gabriel, doctor in the medical clinic. Are you Mr. Donald Trump, 67-year-old?
Yes, doctor, I am.
Okay, Mr. Donald, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor. What will you do for me now? I have cancer and I am suffering from that. There is nothing you can do, doctor.
I am sorry about your suffering, Mr. Donald, but we have a lot to do. The treating team following you and giving you the proper treatment. What exactly you don't like in the treatment?
I am like treatment, doctor. I took all the medication. I am fine. I don't need anything.
So I understand that you are suffering of the bone pain. Is that correct?
I am fine, doctor. I don't need any treatment. I am okay.
And as I understand that you have an issue with the medication was prescribed for you from the medical team. Is that correct?
Oh, doctor, you are the only person who is who is eager to know my condition. They prescribed me medication and they didn't want to know that what this cost to me. So worried, doctor.
Can I know any problem with the medication you are suffering?
Okay, doctor. I some bone pain. I came to the doctor and I think they gave me some medication called morphine and some tablets, ibuprofen. And that I was taking those. I felt so much burning pain in my stomach. I couldn't, and also I developed so much constipation. I couldn't pass my bowel. You know that I have
I'm
cancer and I have bone pain, and along with this, I have those symptoms again. I was going to die, doctor. Why they did this to me?
I'm so sorry about your suffering, Mr. Donald, and I am so sorry that the doctor didn't explain to you that every medication that has side effect, and this famous side effect of the pain medication, and it can be relieved by simple management. We can give you some medication that relieve your stomach ache for your ibuprofen. And any more symptom you are suffering, Mr. Donald?
Doctor, I told you I have severe constipation, even
Constipation,
once a week, even
constipation,
15
all
days a week.
this constipation also expected, and it is common side effect with the morphine. Also, we can treat it by referring you to the nutrition that give you proper uh, advice for your food, and we can give you some laxative that make your bowel motion uh, more soft, so you will not suffer anymore. Is that
Cannot
okay
you
with you,
cannot
Mr.
you
Donald?
stop those medication and cannot you give some good medication, doctor? Along with my cancer pain and I am having those symptoms again, that is making life more pathetic, doctor, and no one cares about me. I am dying. I am a dying patient, so everyone thinks that I am of no use. So they are not paying any attention to me.
I'm so sorry, Mr. Donald, but this treatment given to you in order to relieve your symptom, because the pain that you are suffering from your cancer, it's too much, and it increase your depression level. So by taking the medication, your symptom will relieve and depression will improve. Do you agree with me, Mr. Donald?
Okay, doctor, why did they do this to me? Why didn't they give any medication to relieve my symptoms of constipation or burning?
I'm sorry about that, Mr. Donald. Must be some miscommunication
I
there,
am
but
meaning
but anyway, you are under follow up and you are under the care of team, and you will be follow up, and all your symptom will be treated. Don't worry about that.
Okay, doctor. So what can you do for me? I really suffering from the pain, and even I can tolerate the bone pain, but I cannot tolerate so much constipation, so much burning pain in my stomach.
So there is a specific team called pain control team. I can refer you to the pain team. They can prescribe for you the best treatment for your pain. Your pain should be controlled, and along with that, they will educate you and they will treat all the possible side effects, and you will be relieved from symptom. Is that okay with you, Mr. Donna?
Okay, doctor. Just inform them that they shouldn't go for this type of drugs again. Time off.
Thank you, Miss.
Okay, what was your task?
My task was to talk to Mr. Donald about the pain management treatment and why he is not cooperative with his treatment with pain management.
And what do you think? Could you
Miss,
do your job properly?
I hope so that Mr. Donald was not taking the medication because of the side effect. I was able to explain to him that there is known side effect and there is treatment available, and his pain should be controlled by the medication and will treat all possible side effect by the treatment.
Okay. For this case, you have done excellent. And one thing that patient was initially wasn't as the scenario is given here that this patient has lung cancer. On treatment, he has bone metastasis, feels severe pain. He was prescribed morphine and ibuprofen, but he does not take those regularly and suffers from frequent pain. So there was a hidden clue that there might be something abnormal, so that the patient is not taking this medication. And another thing that he has also depression. Okay. So when you are talking to this patient with depression, so as much empathy, as much uh, softness as you can. So a patient wasn't going to tell you anything. He said that I have no problem. He said that I take those medications regularly. So that, and your scenario is given here that saying that he is not taking those medication and he's suffering from frequent pain. So there might be something abnormal. So that you should show much empathy that okay, I can understand that you are taking, you are suffering from your condition a lot, and I am sorry for your condition, and I can understand that you are getting burdened with this medication. Is there any issues or anything that you want to discuss about me? And I heard that you are suffering from frequent pain. And is there any issue with the medication or any issues with anything that you can discuss with me so that I can help you? Okay.
Mm,
But, showing empathy will allow him tell you in more details, tell you will allow him to unfreeze himself and will tell you. Okay. You didn't
mm,
gave me so much empathy. So as a typical depressed patient, I wouldn't say anything. As you said that you have some issue with the medication, it is not given here. That he is not taking the drugs regularly. You should have asked on your own that is there any issue with the medication? And I heard that you suffer from frequent pain. Is there anything that I can do for you? Is there any problem with the medication? Okay, so that you are
mm.
showing much sympathy. And after the
So,
patient will say, and also the patient was saying that I have suffered from the so much symptoms. He already said that he had burning pain and he has constipation. You should have remembered on your own that patient has once said that burning pain and constipation. So could have you should have solved that at
I
once. that for your burn, I am extremely sorry that you have suffered from this condition. I will review your medication, and for your burning sensation, I will certainly give you some medication. And for the constipation, I can understand that it is it is so it is so much pathetic, or it is so much horrible to having this constipation. And for that, I am certainly I will raise that issue, and I will give you some medication that will help you to relieve these symptoms. And also I will review your medication so that we can give you the best medication that is tolerable to you. And I am extremely sorry that this side effect has happened to you and you couldn't take this medication due to the side effect. After that, if he has asked, you should have told this, because patient was so much worried and was so much frequently telling about that I cannot take this medication due to this side effect. So that you should say that, okay, you will review this medication. You don't know that this was the best treatment or was given there is no alternative. You don't know. So that you will say that I will review this medication, and certainly I will inform the pain doctors. So they will certainly give emphasis on the side effects, and already you have suffered this, and I will make notes so that they can know a better way that you have developed this condition, you have suffered from this condition. Okay, so you should emphasis on the causes why he has debarred himself from taking the medication, so that patient will get much confidence, and he will say more and more things of his non-compliance. Okay,
Okay.
and if you have explained everything well, that was fine. Whenever in this patients like non-compliance patient, always try to reassure the patient that you are going to give something for, you are going to do thing actively for his so that he can comply he can remain compliant to his medication, so that you are going to inform the doctors in a specific note that he cannot take this medication, or he has developed these sufferings due to this medication, so that the doctors carrying him will take extra precaution for this. Okay,
Sure.
so in this case, when a non-compliance, give extra emphasis on that.
Sure.
Okay, this was fine.
Thank
Actually,
you.
this was fine. And also for a depressed patient, so much empathy as you can. You didn't show much empathy. I was not telling. I was telling that I don't have any problem. I take these medications regularly. So that means that for the statement and patient's speech doesn't cooperate. So there's something abnormal. So that at that point you should have become somewhat empathetic, somewhat dramatic. That okay, I can understand that you are going through a lot of sufferings. I am extremely sorry for that. That if there is, and also I heard that you are having frequent pain. Is there anything that is bothering you, so that I can take care of that? But yeah, I am really here to help you. So mass empathy as you can show, so that the patient will get somewhat confidence that you actively hearing his sufferings, you are going to do something for him. You are showing that. Okay, we will
Yes.
practice this type of cases lots more. So don't worry. We're going for the next case. Okay, start.
Hello.
Hello.
This is Dr. Gabras, Dr. in the medical clinic. Are you Mr. Donald Trump, 67-year-old?
Yes, doctor, I am.
Okay, Mr. Trump, we are here today to discuss your condition and what we can do further. Is that okay with you?
Okay, doctor. I was informed that I am normal, so I am going home. Is there any issue?
Mr. Donald, I'm sorry, so sorry on behalf of the whole team treating you. But I want to tell you that there is something unusual happening during delivering the result of your tissue biopsy to you.
What do you mean by that, doctor?
Mr. Donald, I'm so sorry, but because of breaking of the communication between the staff, a wrong result was delivered to you. That saying your result of tissue were normal.
Yes, they said me that I am normal. So what is the problem with that?
I'm so sorry, Mr. Donald, but the result uh, was given to you for different person, and the actual result of you it was totally different in the result from your actual result.
What did you do this, doctor? Why did you do this? What did you do to me? What happened to me?
I'm so sorry, Mr. Donald, but there is something unusual happening, and it's very rare to happen in our hospital.
What happened to me, doctor? I just want to know.
This the actual result for your biopsy showed that you have something serious.
Serious, what do you mean?
The result showed that you have cancer.
Cancer? What are you telling, doctor? And you said that you are I was totally normal person, and you stopped said this to me, and now you are saying this cancer. Are you making fun with me?
I'm so sorry, Mr. Donald, on behalf of all the team. But this
Your story will not bring anything good, doctor. You said that I was normal, I was going to home, and now you are saying that I have cancer. Are you sure, or are you again making some mistake? And after that, you will come again and you will say that you have made mistake again, and I am normal. Are you going for
because
that?
we do,
How did you sure that
I'm
I
so,
have cancer?
I'm so sorry, but because of the first mistake, we make sure twice, and we are sure now that this your result, and it showed a cancer.
I cannot accept this totally, doctor. Who made this wrong thing? And you are saying this cancer? I don't believe you.
Yeah, you are right, Mr. Donald, and it's totally right that you performed this feeling. But really, I am sorry in behalf of all the team.
I
And
don't
this
want to know your
mistake,
story, doctor. I just want to be sure that you said that you said that I have cancer, and I think that you are making a fun with me. I don't believe in
sure,
your hospital anymore.
sure not, Mr. Donald. We care about you, and for that we search again and we make sure that this your result. And I am sure now that this your result without any mistake.
You are sure, but I am not sure. I think you are making mistakes. I am totally fine.
Mr. Donald, our hospital follow very strict rule and regulation. And for this mistake, this is very rare to happen, and we raise a report for that, and it will go to the department directory and the hospital directory and safety, and they will do all the investigation in order this mistake will not happen again.
I don't want to hear anything from you, doctor. I just want to know that who did this to me and why you are making fun with me. I will make a complaint against you. And also, I don't believe your result.
I'm so sorry, Mr. Donald, but this the not the mistake of one person. It is the mistake of the system
Many.
and all the team responsible for this mistake. And we are working as a team here. Your complaint,
Where I can complain.
the complaint totally is your right, and if you want, I will guide you to the Pulse Patient Advisory Liaison Service. They will advise you in this regard.
You are totally
But I
you are so irresponsible, doctor. You said that I am normal. I am normal. Now you are saying that I am cancer. Cannot bear this, doctor. You know that what did you do to me? You showed your team showed false hope to me. Now you are saying that I have cancer. I
I'm
cannot
so
believe anyone else, doctor. I believed you and your hospital that you will treat me accordingly, so I came here. But now you are saying that I have cancer. Again,
Um,
how can I believe you, doctor? I don't believe anyone else. I just want to get rid of your hospital.
I'm so sorry about the mistake happened, but I assure you this will not
Time
happen
up.
again. Thank you.
Okay, so what was your task?
My task to deliver the news of uh, reporting the wrong result to the Mr. Donald Trump about his biopsy result.
Okay, and what do you think that have you been able to convince him that the mistake was totally unintentional?
It is type of difficult scenario. I tried my best and I delivered to him all the uh, how the problem happened and it is unusual and unintentional and it is the mistake of the whole team and it will be corrected by doing the proper step for correcting the system.
Okay, and what type of error is this? What do you think?
It is system error.
Okay, so this patient you already informed him, and the patient want to take second opinion or any opinion. So, what do you think about that?
It is his right to have second opinion, but I will advise him not to do that because we are sure about the result and any further investigation will delay his treatment and management.
Okay, so where he can complain against this issue?
He can go to the Pulse Patient Advisory Liaison Service.
Okay, and will you send him to there, or patient will have to go on his own?
I will give him all the information about it in order to guide him in this regard. But I'll try in the same time to convince him not to raise complaint and that all the step of the complaint will be done inside the hospital and inside the department and it will have the same result.
Okay. Suppose
So
if the
no,
patient want to take legal actions against your hospital, will you help him?
I will convince him that no need to do this complaint as we do all the step to correct
He wants to take
the
legal actions, like he wants to involve the legal, like he want to go to the court and want to file against you.
it
In
is
that case, will you
his
help?
right, but I'll try to convince him that all step can be done inside the hospital and we it will have the same result for him.
My question was, will you help him or not?
I will not help him, but I will guide him.
Okay, that is I wanted to know. Okay, you have done everything well. That was fine. When the patient was angry, that you could say some words that okay, I can understand that you are angry and it is likely to be angry, but please remain be seated and let us discuss this condition in details. And I am again sorry for this. You have done so much excellent. You were so calm. You were so what is called. You were so
What can I do? I cannot fight. I cannot do anything.
you were fine. When the patient was angry, your reaction was somewhat uh, quite normal. That yes, you are going to handle this calmly. Not you are not going agitated. You are not going somewhat reactive to the patient's voice. That was fine. You always try to uh, pardon on your hospital staff, and you also raised the issue that you are going to investigate why this has happened. That was totally fine. We have done excellent. Okay, I don't have anything much thing to discuss about this case. This was fine. Okay.
Thank you. Thank you.